And we're now live. You can proceed.
Good evening, everyone. Thank you for joining us once again. Before we get going, we would like to start with a brief message from Gilbert Martinez from our communication staff team for our Spanish-speaking viewers. Gilbert?
Buenas noches y bienvenidos a la sesión informativa organizada por la supervisora Hopkins y la doctora Mase. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretaciones al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Ahora regresamos con la supervisora Lynda Hopkins.
Thank you so much, Gilbert. I'm Lynda Hopkins, Supervisor for Sonoma County's 5th District and Chair of the Board of Supervisors, and I'd like to welcome you to our COVID-19 community briefing for Wednesday, January 27th. I do want to acknowledge that due to late breaking news surrounding the changes to the stay-at-home order and going back into the purple tier, we are going to be focusing tonight's briefing on that changing news that came out of the state just this week. And we will be discussing equity as our next topic for next week. So with that, it's a good point to remind you all that during this community briefing, we will be taking questions from the public. You can leave your question in the comments area of Facebook Live. We also ask those who will be joining us as panelists to speak loudly and slowly, which is an admonition I often need to be reminded of myself for the sake of our interpreters. Let's begin with our update with a brief presentation by Dr. Sundari Mase, Health Officer for Sonoma County.
Thank you so much, Chairwoman Hopkins, and thanks to everybody for participating today. While we are still deep in the pandemic with widespread community transmission of the virus, we are starting to see hopeful signs that this surge of cases that we're currently experiencing may be tapering off. As you know, earlier this week, the state lifted the stay-at-home order for the entire Bay Area region, including Sonoma County, because of improvement in the region's ICU capacity. While that's good news, we're still in the most restrictive purple tier in the tier system, the blueprint for a safer economy, because of very high transmission rates. Sonoma County's new cases per day per 100,000 is 34.3, still much above the 7 new cases per day per 100,000 we need in order for the county to move into the red tier. Our testing positivity rate is 8.3%, which is close to the 8% required to move into the red tier. However, our testing positivity in the lowest quartile of the Healthy Places Index, a metric that measures equity in the COVID response, is 13.3%. And this also needs to be less than 8% to move into the next tier. While vaccines are still not widely available, these are proven ways that we can slow the spread of the virus and further reopen our economy. And there are many other measures that you should be following also with the rollout of the vaccines. You can take the following steps to help our community. Continue to wear a facial covering or a mask whenever outside of the household and with non-household members. When you go to the store, or maybe when you go to the pharmacy, or for other essential business. Ensure that you are socially distancing at 6 feet from anyone who is not part of your immediate household. And wash your hands, wipe down surfaces, and follow all the general hygiene measures. We need to continue all of these safe practices until we can distribute the vaccine throughout the community. So now Dr. Shende is going to give you an update on our vaccination distribution strategy.
That mute button, I'm sorry. So thank you, Dr. Mase. As of today, the update shows that we have administered 34,802 vaccines in Sonoma County so far. The number of residents who have received their first dose is up to 21,348, and the number of those who've received 2 doses or fully vaccinated is up to 6,727, which represents roughly 1.7% of the adult population in Sonoma County. Meanwhile, we continue to ramp up our vaccination program here in Sonoma County with new clinics opening up almost daily. Today, we launched a new vaccination clinic in Roaner Park for seniors 75 and older through our partner, OptumServe. This is part of an exciting pilot project launched by the state of California. We're only one of 4 counties in the state selected to take part in this pilot program. We'll be able to vaccinate up to 420 people per day for 5 days a week through this site. This site, which is designated for people 75 years and up, is now being operated by invitation only through senior and aging community organizations affiliated with our aging and adult division within the county. But we hope and expect to have a link up soon on our website at socoemergency.org through which local residents can make an appointment at this site. We understand there's tremendous interest and desire to obtain appointments. They are not available online as of yet, but please be patient, and soon we will have that ability on our website. So with this OptumServe site, we're up to 8 vaccination clinics being offered or soon to begin in partnership with the County of Sonoma. I'd like to remind everybody that the County of Sonoma does not administer the vaccines, but we partner with different groups throughout Sonoma County to make the vaccine available and to administer it to residents. These clinics will now have the capacity to provide up to 2,500 vaccinations or more a day for targeted employees or residents in phase 1A of the state's prioritization framework. I want to underscore that this total doesn't include the vaccinations that are given by our hospital partners, such as Kaiser, Sutter, and St. Joseph's, or it doesn't include those doses administered through the federally qualified health centers or through the federal partnership pharmacy program with CVS and Walgreens, which is responsible for vaccinations at our skilled nursing facilities and residential care facilities. So the total number of doses administered each day in Sonoma County will be even higher. By early February, we're still targeting to begin vaccinating our phase 1B tier 1 populations, including those over 65 years of age, as well as teachers and food and ag workers, as well as those in emergency response. We will have more information for those groups as we get closer to that time. Right now, we don't have the ability for those in those groups to make appointments for vaccinations. Everyone is encouraged to go to socoemergency.org/vaccine for up-to-date information on the progress of the rollout, as well as information about options for getting a vaccine and how to volunteer. Thank you, everyone. Let's go back to Chair Hopkins.
Thank you so much, Dr. Shende. In addition to Dr. Shende and Dr. Mase, we are joined by a host of experts this evening, including Paul Gullickson, our County Communications Manager, and excitingly, Mayor Gerard Giudice from Roaner Park to share his experiences of actually visiting the site today. We are also joined by Dr. Jason Cunningham from West County Health Centers, Jonathan Richards, the Director of Primary Care at Sutter, and Dr. Kendall Hamann with Kaiser Permanente. So, my first question is just really for Paul Gullickson, which is yesterday the state announced a few changes in terms of vaccination rollout and has said that it is changing who is prioritized for vaccines. There's some confusion around these changes, so I'm wondering if you could help clarify that for us and also tell us how it will affect us here in Sonoma County.
Well, thank you, Supervisor Hopkins. Yes, indeed, the state has announced a few things over this week, and many of them are very confusing and frankly lacking in detail. Overall, it's clear that they are developing a system to allocate vaccines more quickly to the local level. Right now, there is a lot of frustration that the state's only administered about 2.6 million of the 4.7 million doses that California has received, but they're working on ways to dole those vaccines out more quickly, especially now that the Biden administration has pledged to get more vaccines to the states, which is certainly good news. We don't have many details at this time of what that's going to look like, but we're hopeful that all that what that will come together for the county and mean that we're going to get some more vaccines here sooner, and that's a great thing. The state also launched a new sign-up tool called My Turn that will allow the state to better track where vaccines have gone and who's been vaccinated, and it will also allow people to register and make appointments for vaccines. That's a great thing. Dr. Shende, I think, is going to give a little more detail about that in a second. But the biggest and the most, and probably the worst kept secret really, is that the state will be moving to an age-based eligibility system for receiving vaccines. And the idea is that this would allow counties and hospitals to get our vaccines out more quickly in a more uniform and understandable fashion. But there's a lot of confusion about that and when that's going to kick into high gear. Frankly, there's been a lot of confusion ever since the governor announced that those 65 and older would be eligible to be vaccinated. Some counties have already started taking appointments for people 65 and older, while other counties, including Sonoma County, are focusing on those 75 and older. And we're staying focused on the more tier-based structure. So everybody's kind of doing some different things, but we're hoping to get some clarity on that very soon.
Thank you so much for that update. You know, I know that I'm really excited to hear about the sign up opportunity, and I'm going to ask Dr. Shende about that in a couple of minutes. But I do want to acknowledge that the changes potentially to the tier system have frustrated a lot of folks. You know, partly because it comes so late in the game, and second, because it really disrupts communications and creates confusion when you have different counties approaching things differently. I've also been hearing concerns around equity and the sort of equitable distribution of vaccines. Some of our local Latinx leaders, as well as other, you know, folks who are focused on social justice in our community, have said, yes, we need to get our seniors vaccinated. But what about those frontline workers? What about our farm workers? What about, you know, our grocery store clerks, our food workers? You know, there's concern that some of those folks may be just as high risk in terms of their personal health, and they are also at extremely high risk of actually getting the disease because of their risk of exposure. So when you have that versus someone who might be potentially, you know, say a wealthy retiree who's able to shelter in home and even potentially have their groceries delivered to them, how do we choose between those folks? And are you hearing that frustration in the community? And have you heard any answers from the state?
Well, absolutely. It's a very fair concern, and it's something we're hearing more and more across the state right now, and in Sonoma County, because there's real concerns about how these age-based tiers might really upend our plans to really roll out the vaccines and get them to those who are essential workers and may not have the opportunity to shelter at homes, who work outside the home. So there's one thing I can clear up. However, I do know I was on a call with the state officials yesterday, and they do make it clear that the California Department of Public Health is not expecting to shift to that age-based eligibility system until after we have got vaccinated everybody in the phase 1B tier 1 group. Now, granted, that is a large group now. It includes our essential workers and our ag workers, including our teachers and law enforcement, but now it also includes everybody 65 and older, and that alone represents 100,000 people in this county. Probably, you know, we have about 70,000 people between the ages of 65 or 65,000 between the ages of 65 and 75. So that's a big chunk of people we have to get through. So we're gonna, but at least we'll still have an opportunity to partner with community groups and prioritize our ag workers and our essential workers to make sure that they're in the system and they're prioritized in our current tiers. But it's going to be a challenge, and also we will be getting more changes coming from the state, so we have to be ready to respond to those when they come up.
Thank you very much, Paul. And now I'd love to hear a little bit more about this new My Turn website from the state. Dr. Shende, I'm wondering if you could explain a bit about it.
Yes, things are changing every single day, but the site is live now at myturn.ca.gov. People can use it to register, and they'll be notified when it's their turn to receive a vaccine, but it's not yet capable of letting people know how to make an appointment, where to register, all that. And of course, a lot of that is at the local level. And we are working on it. We still encourage those residents who have insurance to follow up with their primary care provider first to find out what their options are and when the vaccines will be available. But the My Turn site is a good backup. The state says Sonoma County residents can start making appointments in February, but it's a tricky issue for us. Many of these appointment sites are not built to ensure that appointments for Sonoma County residents go only to Sonoma County residents and workers. So there's a lot of cross-county hopping going on. And the websites are out there to help people find sites, but sometimes they allow them to bypass the age or occupation-based rules and guidelines for who it's intended for. So because of that, vaccines can sometimes go to those who know how to use the system or have time or connections to go online and find sites rather than to those within the county who fit into the appropriate tier and those who need the vaccines the most. So it's a real problem. So we're doing what we can to ensure that the appointments at our clinics are going to those for whom they are intended. And that's part of the reason why we have an invitation-based appointment system right now to try and reach our most vulnerable citizens. So there's no easy way around it, but we're doing our best. And we ask for everybody's patience in the process.
Thank you so much, Dr. Shende. And I'm wondering if now Mayor Gerard Giudice could join us, because I know that he was actually out on the ground. And I want to say, I think that the mayor of Roanoke Park works 24/7, because I think I texted him at 5:02 saying, could you jump on this last minute town hall? And I had an answer within 60 seconds. So thank you so much for joining us with little notice tonight. But I'm just curious, I would love to hear your observations. How did it feel? How did it look there on the ground? And then maybe after you share what you observed, Dr. Shende could chime in with, how we're doing the scheduling and things like that.
It was amazing, and thank you, Supervisor, and thank you, Mase, Dr. Mase, and your team for Roanoke Park. It started a couple of weeks ago when I was on a mayor's call with the supervisor and Dr. Mase, and we expressed an interest in Roanoke Park, and lo and behold, this all came together at the last minute. The deal was sealed on Saturday, and here we are Wednesday up and running. I interviewed every one of the seniors who stood in line in the rain, in the cold. And they were so excited and so grateful to get their injections. It was just a heartwarming experience. I teared up, and it was nice to have Supervisor Chris Corsi with me there. And we toured the facilities, and it was just very well run, very efficient. OptiServe is doing a great job, and there's a huge sigh of relief as you engage with these residents. There's just a huge sigh of relief that they're getting their injections. I don't think that there is going to be a lot of people who are not going to want to get this injection. I mean, maybe obviously they were in line, they wanted to, but people were so enthusiastic, and they came from all over. Some were Roanoke Park residents, some were from the town of Sonoma, a lot of people from the town of Sonoma actually. And so it was really great. And Roanoke Park's just excited that we get to do our part to help to be part of the solution. So, so Dr. Mase, thank you. And Supervisor Hopkins, thank you. It was really a heartwarming experience.
That's so great to hear. And thank you so much for both being such a great partner with the county and for going out there and checking it out for yourself, because nothing like that boots on the ground experience. Now, I know that a lot of folks are wondering, how can I sign up to get my shot, right? In Roanoke Park. I'm guessing you're probably getting a lot of calls or email messages.
Yeah, I posted on Facebook today, and watch out, everyone from Jake McKenzie all the way down.
So that begs the question, Dr. Shende or Dr. Mase, how do folks become part of the system? And especially if you've got someone over the age of 75, how will they be able to, avail themselves of that opportunity in Roanoke Park through OptumServe?
Yeah, so we're still working through the bugs of how to get the system right and set up a scheduling system that ensures that the people who really are the most vulnerable over 75 get these appointments first. There's, as mentioned before, there's a lot of cross-county movement and hopping going on. And so the bottom line is these appointments are being filled by invitation only. We have reached out to aging and adult and aging groups, and specifically looking at those with disabilities and those who lack access to be able to make these appointments online. And so we've worked in partnership with various organizations in town. And the site will be up for quite a while. So we'll be posting a link, as I mentioned before, on our website when open appointments are available. But for right now, number one, because this process is just being rolled out and it can't accommodate a huge volume, we don't want the system to crash, as we have seen has happened in other parts of the country and the state. And number two, again, we want to really reach our targeted population. Once we feel that many people in these categories have received an opportunity, then we will open it up. And as mentioned before, we will have that available on socoemergency.org. And again, if people are able to, they should reach out to their primary care organizations to see if they are able to get the vaccine that way. But there will be opportunity to be able to make an appointment. We ask that people be patient. We know it's frustrating. We know how much people want to get the vaccine. It makes a pediatrician very happy to hear how many people were so excited to get a vaccine. And I understand how much frustration there is out there. On a personal note, my parents and my in-laws are all over the age of 75, and they're asking me how they can get in to get an appointment. And I'm telling them the same thing that I'm telling everybody else. Please be patient. And for those who do have access to different systems where they can get an appointment, please be patient. These systems are starting to reach out to their patients. They will make it available. But for those who are able to wait, who are able to, as Chairwoman Hopkins mentioned earlier, are able to stay in their homes comfortably, order food home, and make sure that they can stay safe from COVID, we really encourage you all to do so, to make it available for those who don't have the means to do so. But we will have many more opportunities for seniors over the ensuing few weeks.
Thank you so much, Dr. Shende. We really are all in this together, and it really is a team effort. I'm going to be turning to our healthcare providers locally to check in how their vaccine rollout is. But actually, Mayor Giudice, I was wondering if you had any last words for your community or the broader community before I turn to our healthcare partners.
Yeah, you know, each day there's more light and there's less darkness, and help is on the way. OptumServe has just done an incredible job. And just one statistic that, you know, we had Pedro Toledo from the Roaner Park Health Center present to the council, and you're exactly right, Dr. Shende. Over 90% of the positive tests in Roaner Park came from our Latinx community. So that was a shocking statistic to me and to the rest of our council. But we're very excited, and we feel blessed, and let's go. Let's do this.
Thank you so much. I really
Thank you,
appreciate
Supervisor.
it.
Thank you, everyone.
So speaking of sort of the community rollout and how we're going to achieve equity, I'd love to invite Dr. Jason Cunningham from West County Health Centers to talk a little bit about how West County Health Centers and other smaller providers are going to be working to roll this out. And I really thank you, Dr. Cunningham, for being a champion for equity and for always talking about those frontline workers and trying to think about how they're going to get their vaccines. Folks who don't necessarily have the time to stay on hold for 6 hours trying to be the first one in line. So could you talk a little bit about your work and especially in partnership with other federally qualified health clinics?
Great. I love the energy on this call. I have to say, there is something hopeful about what we're doing, and it's tangible. I think it's also complex. I also hear a lot of this. It doesn't feel quite right. I'm nervous about this. I'm at risk, and I've been at risk for almost a year. My children need to be in school. What about the Latinx population? And I think we as a society really need to be grappling with these hard decisions. There isn't a black or white discussion. This is a complex discussion. And so I really appreciate authenticity. I really appreciate the leadership, Supervisor Hopkins, you're leading. Let's talk about this. Let's bring it on the open. As a CEO and a family doc of a community health center, I got into healthcare because I really feel like this is part of a community opportunity. Most federally qualified health centers came out of the Johnson era war on poverty from communities coming together to say, we need healthcare for our communities. And the vaccine effort, the COVID-19 is in my mind, the epitome of that need to work through the community for the solution. And so we feel strongly at the West County Health Centers that our job is not just to vaccinate our patients, but our patients live in the context of the community, and that our area is the Western Sonoma County. And also the Western Sonoma County doesn't, the solutions along the 101 corridor, those resources that tend to be along the 101 corridor aren't meeting the needs of our clients in Cazadero and Monterrey and Jenner and Bodega and even in Sonoma and Santa Rosa or Sebastopol. And so we feel strongly that our job as a community health center, as part of our job of being in the community of 40 years, is to say we need to vaccinate the community. That in fact, the virus doesn't go between the geographic, it's in a community effect. So the more that we can vaccinate our community, the more that it has a ripple effect within it. And that the context of being able to break up the vaccine distribution into health systems doesn't allow us to be able to vaccinate strategically in community. And so I'm really thankful for that open discussion. How can we do this differently? How can we partner? So we've chosen to approach this from a community-based effort, and we'll be opening up our vaccine effort with partners at our public school districts who have been fantastic partners. We have done a pilot with in-home support workers at Guerneville School and Annalee High School this week. We just had our second one today, and the same thing. It is just amazingly heartwarming to see this happen. We will be turning on a community-based vaccine clinic starting next week that will be available to all West County residents who either live or work there, or who are patients of the West County Health Centers, or their medical home is in the West County. So those who have a medical provider in the West County. And we feel like that's an important area that we need to sow into and to serve. And we'll be doing that as fast as we can. I think as the mission we have is get as many vaccines into shoulders as we can with the distribution that we're working with. So, and the last thing I would say is, it's been heartwarming because in the context of community, we get to do it with the community. We have over 200 volunteers who have signed up to work with us, working with your team, Supervisor Hopkins, working with the fire and first responders, working with the Sonoma Ventnors Foundation. Like, what do we need to do to make sure this is successful? There's a lot of just goodwill for us to say, in the context of community, we do it better. The only caveat I was to say is we need to make sure that we can safeguard that context of, I don't want people coming up from San Francisco to take the spot of somebody who's going to need it in Cazadero. And so that context of how we distribute and how we manage that flow, we are going to ask that we only vaccinate those who are in those spaces. So we're going to ask for grace and for some patience for us as we say, it's really available for this. And we're working with Ken and his team, Dr. Mase and Dr. Shende, to work with all the other community health centers who have a very similar area of influence in their community to say, can we make this community benefit available to all the different areas of Sonoma County? So it doesn't feel like this is just one area that's getting it, but it's a community benefit. So thank you.
Thank you so much, Dr. Cunningham. I'm also grateful that we do have some of our larger providers here. So Dr. Kendall Hamann, would you mind kicking us off by describing how Kaiser is handling appointments for vaccinating patients? And are you focusing on those 75 and older or 65 and older? What is your process going forward?
Sure. Thank you, Linda. I'll start by saying Kaiser in Santa Rosa has given just over 8,000 vaccinations to our own members and also a very large number of non-Kaiser members. And I appreciate this phone call and all of the camaraderie and cohesion that we're able to accomplish together. We, about a week and a half ago, activated a team who is doing an assessment of our residential care facilities throughout the entire county to find out where the care gaps are in terms of the CVS and Walgreens plan to vaccinate those patients. And tomorrow will be the first day that our team is going out to residential care facilities where we've identified care gaps, and they'll be vaccinating Kaiser members and non-members at those sites. So we're very excited to get that off and going and recognize that our residential care facilities are among the most vulnerable population. In terms of the general community, we have pivoted to a focus on our patients who are 75 and older, simply because of the limitations that we have in our own supply of vaccine at this time. And so we have pivoted to a program of outreach for our members, similar to what Dr. Shende has outlined. This is, when we say outreach, it is by invitation, in that we can identify batches of patients who are eligible. But internally, we're also able to apply a COVID risk factor score to large populations of patients, and even stratify within the subgroup of seniors who are 75 and older, those who are highest risk. And provide outreach in the form of email communication, letters, and phone calls in batches in that way. So that's how we've pivoted our access to vaccine over the past week or so.
Thank you so much for that information. Jonathan Richards, I'm wondering if you could give us an update on Sutter.
Thanks so much for being here. I just really want to take a moment and appreciate that this is probably the fastest ever a vaccine has been rolled out in the history of the world. And it's pretty awe-inspiring and a prideful moment that we're part of this wonderful team that's learning, adapting, and serving our community together. So right now, Sutter, we're focusing on completing our staff and affiliated providers who have received their first dose of vaccine, the patients that are healthcare workers that are part of the 1A group, and patients that are over the age of 75 in the 1B group. We've stood up 2 large vaccine locations here in Santa Rosa. I'm presently sitting in one of them. That's all of our supply kit over there. At this location, we're doing about 630 patients per day. At our other location, we're doing around 180 per day, 5 days a week. As we get more vaccine, we'll be adding appointments and locations in Sonoma. And just as you guys know, as soon as we get more vaccine, we'll be opening up to those essential workers and the 65 to 74-year-olds as our capacity increases. And looking forward to partnering with the folks here on this call. We know our staff, we're running 5 days a week, so we have the ability to volunteer at other locations that may be available on the weekends. Just again, thanks so much for letting us be a part of this.
Thank you so much for that update. And now I believe that we have an update available from St. Joseph's as well. And Dr. Rajesh, I'm wondering if you could help me pronounce your last name so that I do not butcher it. Your name reads so beautifully visually, but I don't want to do you disservice.
No worries. I get that all the time. It's pronounced Rendive, but I've heard all kinds of different pronunciations, including Ranadive, and but it's actually pronounced Rendive. So thank you for having me over here for this meeting. So first of all, I want to start out by applauding my colleagues and my leaders in the community for doing such a wonderful job trying to get the whole vaccination thing rolling. I mean, we all know what challenges we all have been facing. COVID has hit all of us, the whole world, really hard, and in this county also. So Dr. Mase has done a great job, and I've been in communication with her. With Dr. Mase from the beginning, and also, So with regards to the St. Joseph Health Medical Group, we, after a lot of deliberation and, a lot of planning, as you can see, that needs to happen, we have started our vaccination clinic. We had our first clinic day actually was yesterday. And there were some, technical difficulties where, because of the rain and all, it put a wrench in our planned site. But having said that, it is started. We started out with the outreach to our patient population of 65 and over. However, having said that, we are focusing mainly on our 75 and over population. The outreach was done to about 17 to 20,000 patients, I would say. And now we are scheduling them by appointments to get the vaccination done. We are also looking currently, I know our senior leadership is also, administrative leadership is also in conversation with the county to see at the Grace Pavilion to see if we can have a space over there so we can get our patients over there. We need a bigger facility to start, so we can start rolling out the vaccines. Currently, our plan right as of now is on a weekly basis, we are hoping to get at least 1,000 to 1,500 vaccinations on that scale. However, a lot of it also depends on the allocation and other challenges that we all are facing. But that's our plan, and if we can secure a bigger place, we are hoping to increase that number exponentially. So that's where we currently stand.
Thank you so much for the update. I know that we look forward to coordinating with you on the physical location, and that we are all waiting for the supply of the vaccine. I feel like now we're starting to really build that ship right? We're starting to, establish those frameworks, and we just need that supply to come in to really hit the ground full steam ahead. I'm going to be handing it over to Paul Gullickson to entertain questions from the audience. But before I do, I also just noticed that Ken Tassif, who is our, I don't remember exactly what we call him, but basically the logistics guy who is really tasked with getting those vaccines out as quickly as possible. I'm wondering, Ken, if you have any updates for us, because I know that you are boots on the ground and 24/7 and coordinating with healthcare providers and standing up new sites. So any updates before we go to Paul for audience questions?
Sure. Thank you very much, Supervisor Hopkins. We're really pleased with our progress with standing up sites. We're certainly ahead of the supply curve in terms of having capacity available. We currently have the fairgrounds site operating today. We have the Roaner Park Community Center operating today. We have the Petaluma, Santa Rosa JC at Petaluma equipped and ready to go. We had a meeting with the Petaluma Clinic folks today and working with them, and they'll be going in as soon as they have enough vaccine capacity to move in. And then we have the Huerta Gym equipped and ready to go, and we're working on getting provider into there, and we're then moving on to the smaller sites and making sure they're ready to go. We're putting in place the support systems for all those sites so that when the providers get there, they can focus on what they do best, which is running a clinic. So we're really pleased about that, and we're seeing that we're having much more capacity to be able to deliver vaccines right now.
Thank you so much, Ken. And if Paul, I bet you've been gathering lots of questions from members of the public, so maybe we can jump into that with the time left.
We do. This is a great conversation and it's generated quite a number of questions. Unfortunately, we're not going to get them all, but I'm trying to group them, if you will. But I'm going to start with one that seems to be kind of sort of a common theme. And it's from Denise, one of our viewers on Facebook. She says, my parents are in the 75 and up category and are trying to schedule an appointment for their vaccinations. Their primary care physician told them to contact the county. They have been calling 211, but are never put in touch with a live person to make an appointment. Is there a specific, what should they do is basically what she's asking. What advice do you give?
I'll be happy to answer that one. So as we've discussed, there are many options that have become available for seniors. And in the near future, can't give an exact date, but very soon, probably over the next couple of weeks, there are going to be many options to be able to book appointments. We realize again how frustrating it is that we don't have that ability today. But over the next 10 to 14 days, there will be options to be able to book those appointments. We understand also the frustration when people do reach out to their primary care providers and they feel like they are not able to provide the vaccine, so they have to, they're referred back to us. We understand, and we are working with some of the smaller providers through the SCMA to create some clinics to allow for smaller clinics to be able to have clinics run through the fairgrounds and other sites. So again, more options will be available. We ask everybody to be patient, and we will ensure that there's plenty of opportunity for people as time goes on.
We also had some questions about why some counties have decided to go to 65 and up, and Sonoma County is targeting those 75 and up. Does anybody want to address that?
Well, one of the biggest reasons is we have a very sizable older population, and more so than many other counties do. So some counties, their populations can and their vaccine supply can accommodate an over 65. For us, our over 75 is significant, and as with everybody, vaccine supply is limited. So we're really trying to target those groups that need it due to age. And as soon as we feel like we have addressed a good proportion of them, then we will go to over 65. That being said, there are different groups in town. Some of them feel that they were able to go to over 65. It's not a clear-cut process. But for us, for the county, we feel that we do need to reach so many individuals in the over 75 who have unique challenges that is our target right now.
I also would underscore that I know there's always a comparison that things are always better in the next county over, but everybody's wrestling with the same issues about how to preserve their vaccines for their residents. And when they choose to go for 65 and over, there's always people that get left out or get frustrated. There's frustrations on all sides. So, and I also would like, Dr. Mase, did you want to say something?
Yeah, if I could just add, we have 102,000 people who are in the 65 and over category. That's 20% of our population. Of that, 36,000 or 75 or older. We've seen our worst outcomes with COVID in that age group, which is why I think it makes total sense for us to focus on 75 and older first. And very quickly, as Dr. Shende has said, we're going to try to get through the most vulnerable and move forward towards the next groups.
Yeah, I also would note that I know there's some comparisons to us with Contra Costa County and other counties, but I can tell you, I looked at their numbers. They're on a per capita basis. They're vaccinating the same rate we are, and the same percentage of their population have received second doses as our has. So we're all plugging along and doing the best we can. So we had some questions about how long, do we have evidence? Jessica from Facebook asked, do we know how long the vaccines last? Is it 6 months or 3? Are we going to need a booster shots, particularly with these new variants that are out there?
Yeah, great question. It appears that yes, we will be needing, whether you call it a booster or a yearly vaccine, it's hard to tell right now. That data is not available. But just as the flu vaccine is something that we recommend yearly, we will at least need to do that. At this point, we don't know if it's going to be an every 6-month issue or not. So as more data becomes available, then we'll have more information about that.
Yeah. And then we have some questions about what's a status update of what's happening in our skilled nursing facilities and our residential care facilities. I know the county and Kaiser are working together to support CVS and Walgreens to make sure to speed up the vaccinations. But a couple have asked if we have an update of how that is going at this point.
Yeah, actually, it's going well. We have so of the residential care facilities that we have decided to go into, along with Dr. Hammond's help from Kaiser, as well as some local home health nursing agencies. We've targeted the ones that haven't had their first visits, and the list is controllable. It's something that we're going to be able to handle, and that means that the rest of them, all the skilled nursing facilities, have had their first and oftentimes second visits already. Residential care facilities, with this action, we're going to be able to reach them. And the next step will be to see if there are ongoing outbreaks where we can be of more assistance. I would like to also add that we are looking into getting vaccinations for homebound seniors. We'll be looking into that in the next week or two to try and reach as many people as we can in that vulnerable population.
Okay, and then finally, Avery from Facebook asks, do we have any dates specific on when we'll be able to start the 1B vaccinations?
No specific date. It really depends how soon we can finish up phase 1A. We still do have people within the tier 3 population who we are trying to get vaccinated. And once we feel that we have reached a lot of the over 75 who are more vulnerable and have less access. So we can't give a specific date, but it's coming. So again, we ask for patience. We are getting there.
Well, we do know. Go ahead, Dr. Mase.
Yeah, sorry, just that, we are into phase 1B, tier 1, with those people who are over 75. Even they are in phase 1B, tier 1. We are trying to finish some proportion left in phase 1A, but we're already in that group. But there are multiple groups in phase 1B, tier 1. And as Dr. Shende just said, as soon as we get through a significant proportion of those 75 and older, then go to 65 and older, we'll definitely march through the tiers and groups.
And we are supporting some groups like the Sonoma County Office of Education, right? They're going to start vaccinating teachers next week. So that's 1B as well, right?
Mhm. Yes, teachers as
Right,
well
in
as
fact,
childcare.
yes, in fact, we're focusing on those 65 and older in those other groups. So that kind of aligns with our general strategy to really focus on the most vulnerable and stay within the tiers of the phases.
Okay, excellent. Let's go to some of our media partners. Let's start with Phil Barber from the Press Democrat. Phil?
I wanted to check one specific thing first. Those vaccinations in Roaner Park today for seniors 75 and older, are those the first vaccinations for the senior population that have been coordinated by the county? I know some have happened in hospitals and so forth.
Yes, I think it is the first. It's not the first plan. We've actually had planning in the works for other senior groups, which are coming up next week. But it's the first that actually happened because this came about in a very, very quick fashion. So technically, yes, I guess it's the first county partner that has specifically given vaccines to over 75, yes.
Yeah, having said that, our MCEs have been vaccinating 65 and older now, at least for the past couple of weeks. And we are collaborating in partnership with them as well. And as far, it was pretty recent guidance from the state to really focus on this group. And we completely agree that we need to move forward with that and are doing so. And actually, there's going to be multiple venues. Dr. Shende, I don't know if you can mention some of the other venues by which we intend to reach this group starting in the next 2 weeks or so.
Yeah, so actually next week we have 2 clinics lined up for seniors at the fairgrounds. And we have 2 clinics also coming up next week in Oakmont for seniors. And we intend to have additional options going forward. Soon we'll have options within pharmacies. So we'll have options where people will be able to register online for Safeway and eventually for Walgreens as well. And again, those appointments are not available. They're not bookable online yet. And as soon as we have information on how to do that, we will put it on our website. So we have many opportunities coming up. And as I mentioned, over the next week to 2, there'll be opportunities to be able to book online.
Yeah, thank you. That was very helpful. I had a question, Dr. Shende, you said something a little earlier about really trying to make an effort to serve the populations we're trying to serve. I know there has been a lot of vaccine tourism, people are calling it, people trying to go from county to county to find shots. I believe that very early in this process, maybe 3 weeks ago or even more, Dr. Baldwin had been asked specifically about vaccinating seniors in the future. And at that time said there was not a plan to ask for ID because it could slow down the process so much and become cumbersome. So I'm wondering at this point, looking forward, as you move into these different populations, what will people be asked to verify? Age, place of residence, even are healthcare workers being asked to prove employment, things like that?
Yeah, so for right now, again, since we are focusing on the over 75 category, yes, we will be asking for ID to ensure. That's one of the most straightforward ways of being able to ensure that people are in the right category. There are many learning points along the way, shall we say. And as we get to each of the essential worker categories, we will come up with some strategies. For the school employees, that's all being done through invitation through Sonoma County Office of Education. So that's pretty straightforward. And they are being asked to bring their work ID to verify that they are who they are. So yes, there will be strategies employed and each group is going to have its own challenges. So as we get to those groups, we will have plans.
Thank you.
Okay, let's go to,
Yeah, I might have more, but I'm going to pass to some other people. Thank you.
okay, yeah. Okay, let's go to Martin Espinoza. Martin?
Hello, Dr. Mase. We talked a little bit yesterday and text this afternoon about transmission, the state of things right now. Sort of right now is when we should be seeing sort of the general impact of holiday gatherings. And what exactly are we seeing right now in these in our new cases? Are we seeing that those secondary transmissions from I guess you could call them primary holiday celebration infections? Are we seeing? And the reason I ask is because you pointed out yesterday that we've never had in our previous holidays a stay-at-home order in place, as we did here with the regional stay-at-home order. What do you think the impact will be? Given that we did have this statewide stay-at-home order?
Yeah, thanks for that question, Martin. And actually, I'm going to turn it over to Kate Pack to talk about the numbers of cases that so far we've seen associated with the holidays and holiday travel.
Hi, Martin. Yes, I earlier this week. At the cases so far, we've seen 131 cases that were definitively linked to Christmas, New Year's, holiday travel. But it's really important to recognize that is a big underestimate. For a lot of cases, unfortunately, we don't really receive the depth of information we would like around where that infection occurred. But, we know from what we've seen throughout the pandemic that gatherings, have consistently played a role in transmission, as well as, household transmission after that, whether the infection is picked up at a gathering or the workplace, the spread that happens in the household plays a big role. And we do have a new page on our cases dashboard that gives a little bit more information about source of infection and the trends that we're seeing both overall as well as, what we're seeing for active cases around source of transmission, and looking, prior to that 30 to I believe 44 or so days prior. So you can monitor that page to see some of the trends that we're seeing. But you'll see that there are a large proportion of cases that are marked as unknown. And that means that we just didn't receive enough information to be able to really make a good determination of where that infection happened.
I do see that. I guess my specific question was whether were sort of the transmission or infections since those primary infections took place, is there any evidence that the stay-at-home order sort of helped to flatten the curve, if you will, the way that our first stay-at-home order did?
Yeah, it's very difficult to measure because the last time we went into the stay-at-home order in March of 2020, completely different circumstances where we had very few cases. I think we had a handful of cases in Sonoma County when we went into the stay-at-home order, and it was extremely effective. When the stay-at-home order was put in place in December, however, we had widespread transmission within the county. So it is hard to say what the impact was. I think in all likelihood, it was effective in decreasing case rates and case numbers to some extent. It also depends on how people are adhering to a stay-at-home order as well. And I'm hoping that we had good adherence even in this last month, and that would have impacted the result as well.
Thank you. Oh, I had a follow-up. I mean,
okay.
Ask quickly. I think it was the mayor of Roaner Park mentioned that 90% of their positive cases there in that city were from the Latinx community. I hadn't heard anything like that in terms of demographics for cities and counties. I mean, for cities and towns Did he get that from public health, or did he must have?
I think he got it from Pedro Toledo is what he said.
So that's I mean, is he measuring the entire city or just the that FQHC, Petaluma Health Center?
I think that's where Pedro got his number, but I would check with him on that one.
Okay.
I believe that's what he was saying. So,
Right. So it's just a patient base for the Petaluma Health Center.
yeah, they have a clinic there. So
Okay. Thank you.
okay, let's go to Susan Walbarst. Susan.
Hi, thank you. I just wanted to know, I read today in the LA Times that the state of California is only using approximately 50% of the vaccines that it has received. And I just wondered if any of you are hiding any in your cars. No, if any of you have any ideas where they've gone, the other 50%, it's a huge number.
I'm thinking that Ken, you need to answer this.
The answer is that, you know, there's a lot of information and disinformation that goes around all the time, and the reality is we don't know all of the elements of the state's strategy. I know that it has changed numerous times, and so I can't necessarily say what is, you know, what they are doing with any holdback that they may have. But the one thing I know is that we are pushing out vaccine as fast as possible and getting it to our partners, and our partners are getting it into administrating the vaccine to people. So.
Yeah, you know, Susan, I think that's the bottom line is it's very hard to track what percentage of vaccine gets out simply because there's reporting delays. It's very hard to kind of follow all the moving pieces, but you can be assured that here in Sonoma County, we are getting out vaccine as quickly as we can to populations that need it.
Okay, thank you.
And the thing, Susan, just to keep in mind, you know, nobody's hiding any vaccines in their trunk, and nobody is, and vaccines are not going to waste. I mean, that they are getting in the arms of people, and so, you know, sometimes they're set aside because they're designated for clinics that are in the process of being opened. There was a time when there was some that we had to set aside to assure for second doses, but these are all targeted, and they go, and we're getting them out, as Ken said, as quickly as possible. Did you have a follow-up?
One other question. Since the stay-at-home orders were lifted and the curfew was lifted, is there actually any practical difference with or without the stay-at-home order for counties in the purple tier like Sonoma? Yes.
Yes, there are some significant differences. I don't know, Paul, we don't have Adam on the line, I don't think, but there are significant differences between being at the stay-at-home order and being the purple tier.
Yeah, Susan, the biggest differences are, you know, restaurants are allowed to do outdoor dining, retail operations, grocery stores are allowed to open up a little bit more, barbershops and hair salons and personal services are allowed to open. So there are, I can send you the press release we wrote that laid out those differences. So,
okay,
okay, let's go to Ann Ernst. Ann?
Hi, I'm just wondering if there's been a location in Sonoma Valley selected yet.
I can go ahead and take that one. The answer is yes. I'm pleased to announce that the Sonoma County, the Sonoma Vets Hall has been selected as the location in Sonoma Valley for a vaccination center, and we'll be working with partners in Sonoma Valley to identify exactly who's going to need what space and when.
Okay, so you still don't have a date then yet, correct?
Well, the partners are as much about us creating the date as we are. We can have a center equipped and ready to go on very short order. Then it's a matter of the partners deciding when they are receiving enough vaccine to make the decision to go outside of their own organization and move into a larger operation.
Okay, and I'm assuming the partners are like Sonoma Valley Hospital and the Community Health Center.
Those would be the two partners that we'll be talking with about this. In fact, we're going to be talking with certainly Sonoma Valley Health Center tomorrow in a meeting.
Okay, thank you very much.
Yeah, thank you.
Okay, it's after the top of the hour. I'm sorry we've gone a little long, but this has been a great conversation tonight. Really good questions. I'm sorry that we didn't get to all of them. I do want to just remind people we have gotten a number of questions related to appointments and equity and getting our, preserving those appointments for local people. I just want to remind you to join us again next week, where we'll get into more of the issues related to equity and making sure we get these vaccines out to our most vulnerable residents. We just want to thank you all for being here and answering these questions. And I'm going to turn it back over to Supervisor Lynda Hopkins.
Thank you so much, Paul. And thank you all so much to our panelists for joining us here today. A special thank you to Elizabeth, our ASL interpreter, and Jordy, our Spanish interpreter, and also Gilbert, who is our fantastic Spanish language introducer as well at the beginning. Just a reminder that you can follow us on the Sonoma County Facebook page. Also follow us on Twitter. We provide regular updates, really honestly 24/7, 7 days a week. So that's the best place to go is social media. SoCoEmergency.org/vaccine also is updated regularly, and that has quite a bit of data and information. We will continue to update that with the latest and greatest information. Finally, as Paul mentioned, please do join us again next week, same time, same place, Wednesday at 5 p.m. to really hone in on those conversations around equity and equitable distribution of the vaccine. Thank you so much for joining us. Stay safe and be well, everyone.